Greater Good Radio. Connect, learn, heal, and grow. You know how I think about it is that, like with a physical wound, I don't actually heal that physical wound. Like I'm not here like, if I got a cut on my arm, it's not like heal, and I'm thinking heal.
Yeah.
It's creating an environment that's conducive for my body to heal itself, right?
Yes, yes.
I feel like it's the same thing internally, which is there has to be an environment conducive to healing itself, which means a safe environment, psychologically, emotionally safe, no judgment in that container, the ability to express authentically in however that needs to be, whether that's physical, mental, whatever it is, right? And then allow that kind of process to kind of run. So I feel like with the psychedelic-assisted psychotherapy or even the ceremonies or so on, it's very different than just a fun time or something, because a fun time would be like having a hip problem, getting anesthesia, no one did any surgery, and then you come back out. You still have a hip problem, right?
Yeah.
Like this, the psychedelics in my mind, it kind of helps lower the pain so the hip surgery can be done. And then you come back out and you still have to, PT it and so on.
Yes.
That's kind of how I think about it. Is that what you see too? Or
Yes,
or
I
what?
think that's a really great way to see that. Yeah. So actually, Michael Medover, who I mentioned, helped develop the treatment manual. It was an emergency room doctor before a psychiatrist. Mm-hmm. He used almost the same language that you just used. Oh. He would say that, let's say you get somebody that had a motorcycle accident, and they scraped the pavement, and they got all this embedded pavement in their wound. So his job is to take the impediments to healing out and create the context for the body to heal itself.
Yeah. You have to have an environment that the body can heal itself. Otherwise, it's not going to. It cannot.
And so let's transfer that now to psychedelic-assisted therapy. So the things that the body, these impediments in physical wounds, in psychological wounds, it's like these emotions are overwhelming. I can't handle them. I can't get to the root cause because it's too scary. So in a way, with MDMA, you take out the fear a lot of these emotions, and then you can feel the emotions, and then you can process and do the healing. So I think your example was just right.
If you resonate with Greater Good Radio, please join our community at www.greatergoodradio.com, where you can get access to exclusive content and offerings. Hope to see you soon.